Again, it was an accident. I got fired from my palliative care job, and my argument is that I was fired for gross competence. I was just too damn good at it, but also for gross arrogance. In other words, with my spontaneous and insightful and rather radical, non-traditional style, I could have great results, and often did, in palliative care.
Well, if I might interrupt for 1 second, what would be or might be an example of your approach that others thought was radical, or something you would say or something you would do with a patient that got great results, but that would seem very radical to others?
Well, I would engage them in deep conversations. Stuff would come up that would be painful, but would be transformative. Physically, I would just use methods that had not been proven, but occurred right to me, and they seemed to be helpful in helping people out of pain or deal with issues and so on. I was very open and multiple approaches. I wasn't just following things by the book. So that was my competence. The arrogance was that I had a very busy life. I was still delivering babies, running my family practice. So I would get into palliative care, and then the nurses said working with me was like working in the eye of a tornado. And other physicians who didn't have my attitude or my particular mindset would legitimately question what I was doing. But I would regard all such questioning as an attack rather than as an inquiry. And I would react like a bulldog who's being threatened. And that's the arrogance. And that's what ended up leading me to be fired. And it was a great firing because, as always, I learned a lot about myself. It took me a while. But it took, and then 3 weeks after I was fired, I got this phone call from a clinic in Vancouver's downtown east side. Now, the downtown east side of Vancouver is North America's most concentrated area of drug use. We have more injection users in this few square block radius than anywhere in North America. So I get this call saying, how would you like to come and work down here? And this is 3 weeks after I was fired from palliative care. Had I not been fired, I couldn't have taken that other job, which then led me to the high point for my career, which is working 12 years with addicted population and eventually leaving family practice and doing that full time. So who orchestrated all this? I have no idea, but it was a beautiful progression.
Something that's come up quite a bit in interviews on this podcast is some variation of sometimes you need life to save you from what you want to give you what you need.
Exactly.
And I think about that a lot. At the very least, it's a pain relieving lens through which to view events that unfold. How do you define addiction? Or maybe a better question is, what is addiction? And along with that, if you want to tackle it, what are poor definitions of addiction or misconceptions?
Fair enough. So an addiction is a complex psychological, physiological process, but which manifests in any behavior that a person enjoys, finds relief in, and therefore craves in the short term, but suffers negative consequences in the long term and doesn't give up despite the negative consequences. So craving pleasure, relief in the short term, negative consequences in the long term, inability to give it up. Now, notice I have said nothing about substances. I said any behavior. So it could be related to cocaine, crystal meth, heroin, fentanyl, marijuana, nicotine, alcohol, whatever. Could also be sex, gambling, internet, relationships, shopping,
work,
eating, work, extreme sports, working out, pornography, any number of human activities. So I said any behavior. Now, the official definition of addiction, according to the American Society for Addiction Medicine, is that this is it's a primary brain disorder. It arises in the brain largely due to genetic reasons. This is how they see it. And I say that's just not true. The other popular idea about addiction is that it's a choice that somebody makes, that people choose to be addicted, which is what the legal system is based on. Because if people are not choosing, what are we punishing them for? So although I think the medical definition is closer to the truth, I don't see it as it's a genetic disorder, and I don't see it as a primary brain disorder. So let me perhaps show you why, if that's okay. So I've given you this definition of addiction. Again, craving relief, pleasure short term, negative consequence long term, inability to get up, would you be willing to tell me if you've ever had an addiction in your life? I don't care to what. I'm not asking what.
Oh, yeah. Oh, I can say yes, and I can tell you exactly what it was.
Okay.
So in high school, I suffered from what I suppose most people would consider depressive periods beginning at latest age 10.
Right.
And never found relief from that until I was competing in wrestling very seriously in high school, all throughout high school. And an older teammate introduced me to ephedrine. So ephedrine,
a stimulant.
Ephedrine hydrochloride, which for those people who are curious, is, well, at least at one point, ephedrine was found, or at the very least pseudoephedrine, in something called primatine mist used for asthma.
Right.
And I think they also mixed it with guaifenesin. Nonetheless, the reason you cannot buy in many places large amounts of primatine mist is because people freebased it into methamphetamine.
That's right.
So you have ephedrine, which is a very strong stimulant, combined with caffeine and aspirin. And when you combine those three, it's not an incremental increase in effect. It's probably logarithmic. It's a very synergistic effect.
Exponential, yeah.
Exactly. Yeah. And he was recommending it for increased endurance. And there is some effect, although it's also very highly thermogenic, which wasn't good for me. So it made me really hot, which was already a weakness of mine. But it ended up providing me with relief. It was a very strong stimulant, and I began to not only use it for sports, but to self-medicate using it. Okay,
so great. So let me quickly ask you, what did it do for you? Relief from what?
It made me, or at least contributed to, euphoria, optimism, energy. So I didn't feel the symptoms of what in retrospect I would call depression, the lethargy, the pessimistic lens through which I viewed things.
Fair enough.
It seemed to magically just erase all of that in about 30 minutes.
So euphoria literally means a good feeling. It gave you energy. It made you feel good. It made you optimistic.
Also improved sports performance, right?
I'm sure it did.
Yeah.
Are those good things or bad things? To feel optimistic.
Those are all good things.
Okay. In other words, the addiction wasn't your primary problem. Mm-hmm. Your primary problem was that you were depressed.
Right.
That you lacked a sense of well-being. That you lacked energy.
Right.
So in other words, the addiction is not the primary problem. It's an attempt to solve a problem.
Right.
And then the real question is, how did the problem arise?
Right.
In other words, this is where my theory is that it's always rooted in childhood trauma. And that the addiction is an attempt to deal with the effects of childhood trauma, which it does temporarily, while it creates even more problems in the long term.
Right.
I would have one more side question for you, given that a stimulant was your drug of choice. This may not be true for you, but do you think, in retrospect, you might have had ADHD as a kid?
Quite possibly.
Because typically, people with ADHD self-medicate with stimulants.
Yeah,
because how do we treat ADHD now? We give people stimulants.
Yeah, Ritalin, methylphenidate.
So a lot of the people that choose stimulants as self-medication, like nicotine and caffeine and crystal meth and ephedrine, are actually self-medicating ADHD.
You see, this is where Dr. Mate's words become so powerful. Many of us have lived years thinking something is wrong with us, whether it's ADHD, addiction, or depression. But what if instead of being broken, you were simply adapting? Think about that for a moment. The parts of you that learned to shut down, to numb the pain, to escape. They weren't flaws. They were survival strategies your younger self created to protect you. And when we start to see it this way, the shame begins to lift. We realize we are not weak. We were wise children trying to survive. And that awareness is the first step toward healing.
It's very likely.
Yeah.
And I was punished by teachers for, I wouldn't say not paying attention, but being interested in other things in class. So I remember very distinctly my kindergarten teacher I'll name her by name because it's shameful. Ms. Bevan. I refused to learn the alphabet because she wouldn't give me a good reason why I needed to learn the alphabet. It was just, you need to learn the alphabet. So she made me eat soap in front of the class and put me at the bad table. She got rid of the bad table, but I was always interested in doing many, many, many things. And in fact, one of the reasons that I started wrestling was because I was very hyperactive. And as I believe the story goes, other mothers recommended to my mom that she put me into something called kiddie wrestling to drain my batteries before I got home. So that makes perfect sense. I've never been drawn to depressants, never been drawn to opiates. In fact, after surgeries, I get very sick if I'm given Vicodin or anything like that. So I've opted out. I've never personally had any issues with alcohol, although a lot of people do. It's always been a draw to stimulants. And once where I got myself into trouble was having never been physically addicted to any substance before. I started using the ECA stack once a day. My friend was using it twice a day. I started using it twice a day. And then I started using it 3 times a day. And you develop a tolerance very quickly.
So you have to take more and more.
And if you stop, the withdrawal symptoms are awful. So I had never experienced that. So I continued after sports to use this. And certainly in the long term, there are some very nasty side effects. But I didn't stop. I mean, for many, many years.
Well, so there's a great link between ADD and addictions, and not just because they both begin with the same 3 letters. And I can tell you about my own ADHD. And this is where we go back to childhood again. So that tuning out, that absent-mindedness, that desire to scatter your attention all over the place, that's not a disease. They say it's an inherited disease. The hell it is. That tuning out, that divided attention is actually... But let me give you a personal question again. If I were to become abusive towards you right now, verbally or otherwise, what would be your options right now?
I could ignore.
But that's not what you would do first, is it?
Not likely. I mean, right now, I would probably just listen and pause. I shut down often if I get attacked verbally because I don't want to respond with rage, which has historically been my response.
I hear you, but let's get a bit more basic about it. The rational response, if I were to become abusive, would be for you to just assert yourself, saying, don't talk to me that way.
Right.
Or it would be to leave, saying, this interview is over. And if for some reason you had not the strength to do either of those, there's other people in the room here with us, you could ask for help.
Right.
But what if you couldn't escape, fight back, or seek help? Then you would shut down or tune out.
Right.
In other words, the tuning out is simply a defensive response on the part of the brain. Now put me back into my infancy, when my mother is so grief-stricken that I'm crying because she's in pain. And I'll read you a quote here, if I may.
Yes, please.
And this has to do with the sensitive child. The child is very open and can feel the pain and suffering going on in its immediate environment. The child is aware of its own body and can also feel the tension, rigidity, and pain in the body of the mother or of anyone else he's with. If the mother is suffering, the baby suffers too. The pain never gets discharged. The organism does not develop the confidence that it can regulate itself, that things will happen the way they should, hence lack of optimism. Okay, now, my mother didn't abuse me. She did her best to look after me, but she was stressed, depressed, terrorized, grief-stricken. I'm picking that up as a sensitive infant. Can I fight back, change the situation, or escape?
No.
None of those. What can I do? Nothing I can do. My brain will tune out as a way of dealing with the stress. So I'm not talking about abuse here. I'm just talking about stress mothering or parenting. The child's brain then will tune out. When is the child's brain tuning out? When the brain is developing. So the tuning out then becomes programmed in as the default setting. And that's why ADD. So it's not an inherited disease. It's not a disease at all. It begins as a coping mechanism, which then gets programmed into the brain. And as a lot of these early coping mechanisms function, they help you in the short term create problems in the long term. And that's ADD is one of these examples. And of course, it also makes you more prone to be addicted, because now when you tune out, life becomes less interesting. You shut down emotionally, you protect yourself. Now you feel depressed. What does depression actually mean? You said you were depressed. What does depression mean? To depress something is to push it down. What do people push down in depression? They push down their emotions.
Yeah.
Why would they? Because the emotions are too painful. So even depression becomes as a coping mechanism. You push it down so you don't feel the pain. But then later on, that interferes with your life functioning. So it all begins as a coping mechanism, and later on becomes a source of dysfunction. I knew that this wasn't a genetic disease, that what it is actually is a coping mechanism, which got programmed into the brain. And then when I read the literature on brain development, wow, turns out that the human brain is shaped by the environment, and particularly by the adult-child relationships. And so it all began to make perfect sense to me.
The first is, rather than asking why the addiction, asking why the pain. Right?
Exactly.
So instead of looking at the consequences, looking at the causes.
Yeah.
And not confusing the symptoms with the causes. So instead of asking why the addiction, asking why the pain. View of addiction, you mentioned this. Compared to the clinical perspectives that addiction is a matter of individual choice, moral failure, or weakness, which is why so many approaches are based on deterrence and punishment, which includes self-help approaches, for that matter, that I've attempted myself.
Let's pause here for a moment, because this changes everything. For so long, society has asked the wrong question. Why the addiction? Why the behavior? Why can't they just stop? But when we flip that question and ask instead, why the pain? Suddenly the story makes sense. Addiction is not a choice. It's not a moral failure. It's a response to wounds that were never healed. And if you've carried those wounds, maybe you recognize this in yourself. Every craving, every escape, every restless impulse, it was never about weakness. It was about soothing pain that no one else could see. And that realization opens the door to true healing.
The clinical view is that addiction is a disease of the brain with disordered brain circuits and behaviors, an accurate yet narrow perspective. So I think that's a really important line, an accurate yet narrow perspective. So perhaps accurate but incomplete, right? It is accurate that the addicted brain is demonstrably a physiologically dysfunctional brain, but narrow because it seeks to explain the dysfunction in strictly physiological and biochemical terms without recognizing the emotional and social component of how the brain works. And this was really driven home for me recently. In the last several years, I've gotten to know Tony Robbins.
Yes.
And I attended an event not too long ago with several of my very close friends called Date with Destiny. And at this event, he asked the audience of about 5,000 people, how many people here know someone who takes antidepressants? Pretty much every hand goes up. How many people here know someone who takes antidepressants yet is still depressed? And it was probably 80% of the people who raised their hands the first time. And I personally know quite a few people who take antidepressants, which seem to help on some level.
Yeah.
Although the tolerance for some of these pharmaceuticals can also be developed very quickly. And yet, if my experience is anything like the experience of, or I should say, if the experiences of other people is anything like my personal experience with friends, let's say, who have depression, you witness these thought patterns and verbal patterns that can take them from the highest high or just a baseline of optimism and drive them back into depression. And so they're just, it seems to be just from an empirical or observational standpoint, more to the story, right? So I really appreciate you putting into words what I've grasped to try to understand and also convey. So with this definition of addiction, how do you work with patients?
Well, let's go back to what I said, what you quoted me saying, not why the addiction, but why the pain. So if we understand that addiction in every case is rooted in some painful internal experience, and that when you ask people, what does the addiction do for you? They'll say, it numbs me, it soothes the pain, it makes me feel connected with other people, it gives me a sense of control, it gives me inner peace. Well, the lack of inner peace, the lack of control, the lack of connection, they're all forms of emotional pain. If I ask the question, not why the addiction, but why the pain, then that leads to an examination of that person's life, rather than looking just at their brain chemistry. So I'm quoting from an article that appeared in the Journal of Pediatrics, which is the official journal of the American Academy of Pediatrics. It's about as prestigious as you can get. 2012. The article comes from the Harvard Center on the Developing Child, again, a prestigious child development research institution at Harvard University. This article did not present new information so much as it elegantly summarized decades of research. And notice what they say. They say growing scientific evidence demonstrates that social and physical environments that threaten human development because of scarcity, stress, or instability can lead to short-term physiologic and psychological adjustments that are necessary for immediate survival and adaptation, but which may come at a significant cost to long-term outcomes in learning, behavior, health, and longevity. That's what I was saying before. That those early adaptations, like pushing down your feelings when the feelings are too painful, will help you as an infant, as a young child, but then they cause problems later on. The tuning out that you do to protect you from the stress in your environment, if you're very sensitive, it doesn't take a lot of stress, helps you endure, but in the long term becomes a problem. That's exactly what they're saying. Now, I'll jump a few pages ahead to what they say about brain development. And this is so crucial, and it's so crucial because they still don't teach this in medical schools, even though scientifically it's not even vaguely controversial. The human brain develops in interaction with the environment. It's not genetically programmed purely. Here's what they say. The architecture of the brain is constructed through an ongoing process that begins before birth, continues into adulthood, and establishes either a sturdy or a fragile foundation for all the health, learning, and behavior that follow. Not some of the health learning, all the health learning. Now notice what they say. First of all, the architecture of the brain is constructed through an ongoing process that begins before birth, which already means what happens in the womb already has an impact on you. So if your mother is stressed and she's got high levels of stress hormone, that's already affecting your brain development. And when you think of all the stressed pregnant women out there, no wonder we're seeing so many kids in trouble. And we know from American studies, international studies, that when mothers are stressed, their placenta will naturally have more cortisol and adrenaline, the stress hormone. Those kids will be more likely to have stress issues later on, abnormal stress hormone levels even at 1 year of age, behavioral problems, learning problems, and so on. Which tells us a lot as to why adopted kids have so many more problems. That's another issue. But the next paragraph is key. The interactions of genes and experiences literally shapes the circuitry of the developing brain and is critically influenced by, in other words, the circuitry, the chemistry of the brain, and which centers and which circuits and which systems develop, and which neurochemicals will be present in what quantities, depends on the early environment, and is critically influenced by the mutual responsiveness of adult-child relationships, particularly in the early childhood years. In other words, the most important influence shaping the physiological development of the brain is the quality of parent-child relationships. Now, when parents are stressed or distracted or workaholics, like I was a young parent, if there's instability, economic troubles, relationship troubles, unresolved trauma on the part of the parent, loving parents who are just stressed, that'll interfere with the child's brain development. That's why we're seeing so much more ADHD now, so much more autism, and so much more other problems because of stress in society that affects the parenting environment. In other words, yes, there's physiological problems with the brain, but it's not a genetic issue. It's related to early experience. So when you look at brain scans of adults that are troubled brain scans, as you do in addicts, you're not just looking at the impact of addiction, you're also looking at the impact of childhood trauma and childhood stress. And this has been shown over and over and over and over again. So there's no separation between the physiology and the psychology. So if you come to me as an addict and you say, I got such and such, and I ask you, what does it do for you? And you say it numbs the pain, then my question is, where did you develop the pain? What happened? And then we have an inquiry. And now it no longer becomes a shameful thing that you chose this, nor does it mean that you're stuck with it because you got this genetic problem. We get it as an adaptive response to something that happened. and we can heal that. The reason why addiction treatment is failing is because physicians don't understand this. They keep dealing with the effects, which is the addiction, and the behaviors, which are the effects of the addiction, but not the cause, which is the childhood distress. And the impact of childhood distress that carry into adulthood, in other words, how we stay prisoners of childhood.